Place 2 fingers on your wrist right now. This pulse is a real-time measurement of your internal biological clock. Clinical guidelines often categorize a heart rate between 60 and 100 beats per minute as normal. However, in longevity science, normal is rarely the same as optimal. By the end of this video, you will calculate your true baseline, map it to your biological age, and follow a protocol to drop that number by 10 to 20 beats. A high resting heart rate indicates that the cardiovascular system is working harder than necessary to maintain basic function, signaling accelerated biological decay. Most people check their pulse after sitting at a desk or looking at a phone. That provides a mildly stimulated rate, not a true resting baseline. Finding your true baseline requires a specific environment. Measure it immediately upon waking, still lying in bed, before any movement, screen time, or caffeine. Count your heartbeats for exactly 15 seconds and multiply that number by 4. Repeat this for 7 consecutive mornings and use the average as your starting point. Without removing these daily variables to capture a clean baseline, any attempt to track or improve your cardiovascular efficiency is essentially guesswork. Researchers at the Norwegian University of Science and Technology developed a fitness age metric. It demonstrates that the age of your heart often differs significantly from the age on your birth certificate. Consider 2 40-year-olds. The person with a resting heart rate of 55 has the cardiovascular system of a 28-year-old, while the person at 85 beats per minute possesses the heart of a 55-year-old. Look at these clinical ranges. Rates above 90 are considered high risk, while the 50 to 60 range indicates excellent cardiovascular conditioning. Data shows that every 10-beat increase in your resting baseline correlates to a measurable decrease in your lifespan and long-term cognitive health. An elevated heart rate is often caused by an untrained heart muscle. When the heart is weak, it must beat more frequently to circulate blood throughout the body. Strengthening this muscle requires 30 to 45 minutes of cardiovascular exercise, 4 to 5 times a week. This is Zone 2 intensity. Verify it with the talk test. Your pace should allow a steady, fluid conversation without gasping for air. This training increases the heart's stroke volume. Because the heart pushes more blood with every beat, it can complete its job with fewer total beats per minute. Beyond exercise, your heart rate is driven by 4 silent factors. First is chronic stress, systemic body inflammation, mild daily dehydration, and poor sleep quality. Your recovery routine begins with immediate hydration upon waking and brief cold exposure, improving cardiovascular efficiency. During midday, use 5-second breathwork to actively lower cortisol spikes that drive your heart rate upward. In the evening, observe a strict caffeine cutoff 8 hours before bed and aim for 7.5 to 9 hours of sleep to prevent a creeping increase in your baseline heart rate. Maintaining an optimal heart rate is a 24-hour commitment to protecting the nervous system, extending far beyond the minutes spent exercising. Following this protocol consistently can drop your resting heart rate by 10 to 20 beats within 90 days. This reduction in beats per minute represents a 10-year reversal of biological cardiovascular aging. Chronological age is fixed, but your resting heart rate is a responsive metric that you have the direct power to manipulate and improve. Measure your true resting baseline tomorrow morning while you are still in bed. Post your starting number in the comments to begin your